don't think there's a best age as such, but I think certainly the younger you are, the higher the risk, lifetime. I'm talking about lifetime risk of revision. So there are studies that have looked at lifetime risk of revision, because this is quite a commonly asked question from patients, where they ask, the question is, would I need another operation? Should I delay my procedure so that I can avoid another operation? So large population studies have shown that if you're in your early 50s, you maybe have a 37% risk of lifetime revision. Whereas if you have a hip replacement or knee replacement at the age of 72, your risk of having to have it done again is like 5%. So you can see a marked difference between a younger patient who's got higher activity levels, greater demands of the joint, needing an early revision surgery, and somebody who has it much older. But I think beyond that, you can try to extrapolate the data, but I think if you're in between, then I don't think it's all dependent on the patient. Your symptoms, your function, your attitude to risk, failure or not of non-operative treatment or otherwise.